In 2022, in August, I was at a clinic on Bond Street. I was seeing one of the UK's leading vein specialists about my varicose veins in my legs because they were starting to cause me pain. And he explained to me about the higher varicose veins in my thighs could be a symptom of pelvic congestion syndrome. Now, I'd never heard of it, and I said, what's that? And he explained it to me about the pain. I went, I've had pain since 2017.
Pelvic congestion syndrome, or ovarian vein reflux, as it's also known, is a condition that can cause pelvic and ovarian veins to pull with blood, enlarge, and press against surrounding organs. It's essentially varicose veins in the pelvic area that can lead to chronic pelvic pain in women. Although less commonly, men may also have a version of pelvic congestion syndrome, diagnosed usually through visibly enlarged veins in the scrotum, also known as varicoceles. Symptoms of pelvic congestion syndrome vary so much, and also they overlap with so many other diagnoses, hence why it's missed, and also we don't fully understand the causes. I will explain the causes in a few minutes, but the symptoms to look out for: pain or aching around the pelvis and lower abdomen going on for greater than 6 months, a dragging or fullness sensation in the pelvis, particularly legs as well, passing urine accidentally, so coughing and sneezing and urinary incontinence, deep pain during sex. The most taboo thing that we ever don't talk about enough about is about pain on sex, but aching in the pelvis after sex. Worsening irritable bowel symptoms such as bloating, constipation, and diarrhea. Now, the veins are also affected by hormones. We've understood that. The menstrual cycle may also cause a pattern where the pain is worse. So it's really important to track your symptoms in regards to where you are with your menstrual cycle. A comprehensive review of pelvic congestion syndrome was done in 2020, and even the researchers there concluded they're unsure what the cause is. It seems to be more common if you've got a family history of varicose veins. Hormones, the fluctuations of hormones can also be associated with the laxicity of the veins as well, and also they found an association with polycystic ovaries or polycystic ovarian syndrome, and that's probably due to, again, the hormone fluctuations in this condition, and also PCOS is linked to higher weight gain, and that could be a risk factor for those that can go on to develop pelvic congestion syndrome. Pelvic congestion syndrome also seems to be more common in pregnant women, and more so if you've had more than one pregnancy, because this increases blood flow to the pelvic area and ovarian veins that can be compressed as the womb expands. So either of these can cause valves in the vein to stop working and the blood flow to go backwards, leading to pelvic congestion syndrome.